And welcome back. Dr. Bushra Shah with the Longevity Center at St. Vincent is here to tell us more about what causes something maybe you've experienced before. You know it as heartburn, and there's certain things to keep in mind about heartburn and certain things maybe people don't know, like it doesn't even involve the heart, right?
Absolutely. Heartburn has nothing to do with the heart. It is one of the symptoms associated with your digestive tract.
Oh, okay. But since it's in the chest,
yes,
close to the heart, that's what they say. So talk about what happens exactly that causes it to have that burning sensation in your chest.
Heartburn, like I said, is a symptom of the digestive tract. So basically, there's an opening or a sphincter towards the end of your esophagus, which is your food pipe, and it's connected to your stomach. When this opening does not close completely, and there's continuous regurgitation of acid back into the esophagus, then that can lead to heartburn. And it's called heartburn, I guess, because people think it's in the chest and it's related.
It's close to the heart.
Yes.
Yes. Okay. What about some of the different things that basically can help the effects of heartburn be lessened? Some things to keep in mind.
Heartburn can be, you try to avoid triggers like coffee, either caffeinated or decaffeinated, citrus drinks, carbonated drinks, tomato juice, tomato products, chocolate, mints, peppermint, certain medications like aspirin and ibuprofen.
Okay.
They act against the protective mechanism lining of the stomach, and therefore they can lead to erosions and symptoms of pain and acid reflux. Some of the other things that can cause acid reflux are hiatal hernia. I don't know if anybody's ever heard of such a condition, but it's when part of your stomach pushes up in there's a muscle called the diaphragm between the chest and the stomach, and the stomach sort of pushes up through that. That's called a hiatal hernia, and it gives rise to symptoms of acid reflux. Pregnant women experience more acid reflux because, again, there's increased pressure in the intra-abdominal cavity, and the smooth muscle relaxes in pregnancy. Take the effect of gravity away, bending, lying down, that can also increase acid reflux. So in those patients who are prone to what we call gastroesophageal reflux or GERD, we ask them to elevate the head of their bed, get a pillow that's at a 45-degree angle. Sometimes we even tell you to put bricks at the end of your bed. For severe cases, they sleep in a more like in a recliner. So those are some of the conditions that can contribute to obesity. Losing weight helps with lowering acid reflux.
And when you look at all those different things and some of the cases that you guys see, can it be serious enough to see a doctor, or is it something you treat at home?
Mild acid reflux is typically not serious, and if you occasionally have it, if you had a spicy food, and I'm sorry, spicy foods, greasy foods are contributors to acid reflux. But if you're repeatedly having symptoms of acid reflux, then you should see a doctor, and having reflux more than 3 times a week is something to be concerned about. And there are certain symptoms that you can develop which are alarming, such as if you have pain on swallowing, because what acid is doing is it can erode the lining of your esophagus, and it can cause scar tissue, and the opening in the esophagus narrows, and therefore it becomes harder for food to pass through. So you can develop strictures. Constant bathing of the esophageal lining in acid is not good for the esophagus. So in those conditions, you must see a doctor, and you must try to figure out what it is, and maybe they can guide you through eliminating triggers or putting you on treatment.
What about surgical procedures? Are those possible to help?
You know, if one of the complications of reflux, you can develop an ulcer, and there are surgical procedures for that would need to be done for ulcer, although our goal is always to primarily medically manage patients, and there are proton pump inhibitors and H2 blockers like Zantac, Prilosec that everybody knows about, and regular Tums, Mylantin. But there is a procedure which is not invasive. It's called transoral unincisional fundoplication, and it is done at St. Vincent. So that there is a surgical procedure that can be done to reduce acid reflux.
Okay, excellent. We had an animation there to show you, and if you have any questions, always you can call the Longevity Center if you'd like to make an appointment, and you can always visit them. The address is on your screen. Dr. Shah, thanks for coming in today.
Thank you, my pleasure.
Really appreciate it.